good day everyone. I am Leifa Fuentes, a BSN second year student of Visayas State University, and now we will talk about a new topic, which is the newborn reflexes. Doctors and nurses examine a baby's reflexes to see if his or her brain and nervous system are in good working order. A reflex's presence and strength are crucial indicators of nervous system development and function. Many baby reflexes fade away as kid grows older, but some persist into adulthood. First is the blink reflex. The blink reflex is the fast closure of a newborn's eye when an item comes close to it. This reaction, like that of adults, serves as a safeguard against eye injury. A sudden movement of an object towards the eye might also trigger the blink reflex. This is crucial for evaluating and visual attentiveness of neonates. Second, the rooting reflex. Brushing the newborn's cheek or stroking around the lips will lead the newborn's head to turn into that direction. So the abnormal findings of this is the absence of rooting reflex indicates serious CNS diseases. Third, the sucking reflex. Sucking motions are made when the baby's lips are touched. A sucking reflex, like the rooting reflex, aids the newborn in finding food. At 6 months of age, the sucking reflex goes away. The abnormal findings is a weak or absent sucking reflex may indicate a neurologic disorder, prematurity, or a CNS depression caused by maternal drug use or medication during pregnancy. Fourth, extrusion reflex. Any food placed on the anterior section of a baby's tongue will be ejected until they are 4 months old. This serves as a protective purposes of preventing the baby from consuming hazardous or poisonous things. This is also why complementary feeding or solid food in the introduction begins at 6 months of age. Fifth, the palmar grasp reflex. A palmar grasp reflex is when you put something on the baby's hand. It it reacts as like it will hold, or the baby will hold that thing. So the abnormal findings is a diminished response usually indicates prematurity. No response suggests neurologic deficit. Asymmetric grasp suggests fracture of the humerus or peripheral nerve damage. If this reflex persists past 4 months, cerebral dysfunction may be present. Sixth, walk-in-place reflex. The placement reflex is a reflex that is very similar to this one. The primary difference, however, is how it is elicited. The newborn's lower leg's anterior surface is made to contact the edge of the bassinet or a table. The infant then makes a few rising actions as though attempting to climb atop the table. The abnormal findings is an asymmetric response may indicate injury of the leg, CNS damage, or peripheral nerve injury. 7. Tonic neck reflex. When you turn your newborn's head to one side, the limbs on that side will lengthen, while the opposing extremities will contract or flex. Between 8 and 12 weeks, this goes away. The abnormal finding is the reflex persists until later in infancy. Brain damage is usually present. 8th is the Moro reflex. The drop method, in which the nurse takes the infant entirely off the bed while holding the head and neck, and then swiftly lowers the baby until there is only 4 to 8 inches between the baby and the bed, is the most common method utilized. It's vital to remember that baby is kept in a supine position during this process. Abduction of the arms on both sides, expansion of the forearms, and full opening of the hands are all part of complete Moro reflex. The hands are then slowly brought back to the midline, followed by the curling of the fingers. The abnormal finding is an asymmetric response suggests injury of the part that responds more slowly. Absence of a response suggests CNS injury. If the reflex was elicited at birth and disappears later, cerebral edema or intracranial hemorrhage is suspected. Persistence of the response after 4 months suggests CNS injury. Ninth is the Babinski reflex. The newborn's toes fan when the nurse massage the sole of the foot in an inverted J curve from the heel upward. Positive Babinski reflex are only regarded typical in neonates. It is usually goes away after the 3rd month. The abnormal findings is a positive response after 2 years suggests pyramidal tract disease. Then, reflexes of spinal integrity, and it has 3 reflexes to test. First is the magnet reflex. This can be evoked by putting pressure to the soles of the baby's feet while they are laying supine. The babies would push back against the pressure as a reaction. The second one is cross extension reflex. When the other leg is extended and the sole of the foot is disturbed or touched by a sharp instrument, the infant is in supine posture, will raise and extend his or her leg. This is similar to a newborn trying to shove the hand away from the other leg, which annoys it. Third, trunk incurvation reflex. Finally, when their paravertebral area is contacted by a probing finger, neonates lying in prone posture flex their trunk and swing their pelvis towards the direction of the touch. Lastly, the Landau reflex. If a baby forced to lie in a prone position with the nurse's hand supporting the trunk, muscle tone will develop. Babies who sag into an inverted U position have severe weak muscular tone even though they are not supposed to elevate their head or arc their back and position. In such circumstances, additional evaluation and treatment are required. That would be all. Thank you.